Self-management gentler techniques, straight leg raise with the neck slider tensioner. We've used this technique a lot in the DVD, but it's also a technique which mobilises the entire neuromeningeal system. Here it is as a slider, and here it is as a tensioner. Self-management stronger movements, the ring technique. Here I've asked Claire to do spinal rotation. This is a good joint and muscle mobilisation, but it also creates a ringing movement on the neuromeningeal tissues. If the head is taken the opposite way, that will be further neural mobilising, and then note Claire's also tucking her chin in as she rotates. It could be taken further. You could also depress the shoulder girdle as well. But imagine wringing the spinal cord and neural tissues as though you were wringing out a wet tea towel. Self-management stronger technique, slump long sit with a shoulder shrug. Claire's leaning on the wall here. As she's extending out her left knee, I've also asked her to elevate her shoulder girdle. The elevation of the shoulder girdle releases some of the load on neural tissue, so it's a slider technique. And of course, it could also be done using the neck, but the shoulder girdle position may be useful for patients whose necks are too sore to use. Self-management stronger techniques. We call this the kick your head off technique. Claire's holding her thigh, extending her knee, and extending her neck at the same time. I'm getting her to imagine she's kicking her head off. It's a slider. Here's the tensioner movement. Self-management, stronger movements. A slump tensioner focusing on the perineal nerve. The same technique can be performed here with the foot in plantar flexion inversion. And of course you could also do it with more of a focus on the tibial nerve if the foot was held in dorsiflexion eversion. Self-management stronger techniques, wall walking. Claire is in supine and walking up the wall. Note that her hips are some distance from the wall. As a progression, if she moved closer to the wall, this would be more aggressive along the whole neural tissue system. Self-management, stronger techniques, the total slump. I've got Claire to squat, and then to tuck her head in first in spinal flexion, and then to stand up and flex her spine. Using order of movement principles, this is an aggressive mobilisation, focusing on neural tissue in the cervical spine. You may need a chair or a bed to balance. Self-management, stronger techniques, the rollover. This technique may not be for all patients, but as you can see, it provides an aggressive total neural mobilisation. In this position, Claire is now doing a little more straight leg raise.